Good morning, everybody. I just could not help myself. I have to, I want you guys to pay attention to the words right here. And I want you to listen real well to the audio. Let me make sure we're turned up here. Because I have a response to this. Okay? And I'm going to make this quick.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths?
Oh, you mean people like me? That a lot of people out there are going to watch this video or probably not watch this video right now and say, oh, no, that guy's nuts.
Are being padded.
You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward.
I'm going to leave it at that. Now, let me make this super quick. This is what they're talking about. The World Health Organization sends out the emergency ICD codes for COVID-19 classifications. 7.1 is virus identified. 7.2 is virus not identified. Okay? Let's just leave it at that. URL's right here. If you guys want to pause the video, go check it out yourself. Do that. On March 4th, the CDC sent this out, courtesy of NCHS NVSS, by Stephen Schwartz, PhD, the director, on how to fill out death certificates, which is exactly what that guy in the video is talking about. He's being told how to fill out a death certificate, and he thinks it's completely ridiculous. The broad COVID-19 death count. Go find this video yourself. Okay? Yeah. Financial incentives. So, this was released. This went out. A bunch of people had questions. Who had questions? Anybody above, because this is being forwarded to the state statistical staff. So this is coming down the line from people above state statistical staff in your office who are involved in the preparation of mortality data, as well as others who may receive questions when the data is released. So anybody fielding calls, fielding emails, anybody, hey, this is how it works, right? Well, what is it? 7.2 right here. NCHS not planning to implement that for mortality statistics. Sweet. So we have a divider. We have actual COVID cases, 7.1, confirmed by a laboratory. And then we have everything else. So we don't need to see this anymore. We don't need to see this anymore. We don't need to see this anymore. So let's take a look. World Health Organizations, United States, 16,596 deaths. But under which code? 7.1 or 7.2? Let's look. Johns Hopkins. And you're going to have to probably Google it. I have an ArcGIS account, so my URL might be different from yours, but all the rest should be the same. Yeah, that's at their website. They've embedded it, so just Google this. You'll find it. Right now, it's showing that in the U.S., we have 18,860 deaths as of 4/11/2020, 8:42:18 a.m. Okay, that's a fact right there, according to them. But under what system of coding? I want you to see this. Go to cdc.gov, coronavirus 2019, NCOV, COVID data. It's right here. Pause the video. Type it in. Updated, April 10th, 2020. Here's the math through October through April 4th. Influenza numbers, right here. Pneumonia, way up here. COVID-19. Doesn't start till over here, respectively. Notice there's a big gap when they start talking about when that testing was available. But heck with that. Who wants to guess? Who wants to look at this and guess? Here's the table that they used to create this graph. So right here, COVID-19 deaths. Now remember, this is NCHS data. They do not use 7.2 coding. They only use laboratory confirmed deaths. So no guesswork. We know this person died. It was a direct result of COVID-19, nothing else. There's a lot of zeros here, folks. Oh, here we go, week 9. Now remember, for the week ending April 4th, okay, so the week ending in April 4th is week 14. 5, 18, 45, 415, 1764, 1818. 18,000 deaths. I feel like we're a little shy. I wonder what the math would say. 5, 5, 18, 18, 45, 415, 1764, 1818. Yeah, we're a little shy. Apparently, New York is hiding some people from us, and apparently the whole rest of the country is hiding a lot of people from NCHS. Interestingly enough, folks, I want you to give you some perspective here. So take a look at the pneumonia deaths for the same period. COVID death, pneumonia death, COVID death, pneumonia death, COVID death, pneumonia death. Why are these numbers low right now? Because this is static and the data usually takes a week or so to roll in. So to see accurate data for this, you would have to come back next week. I come back every day, as I suggest you do too. Because pure and simple, any way you look at it, that number does not match that number. Seem to have a problem here, folks. Have a great day. Please keep sharing my videos, keep sharing the information. Together we will stop the virus. And the virus is not COVID-19. The virus is misinformation.